Dr. Jamie Mitchell had dedicated 8 years to saving lives at Westlake Memorial, but one decision would cost her everything. When a critically ill patient arrived without insurance, she made a choice that defied corporate policy. The hospital called it financial misconduct. She called it being a doctor. But when faced with choosing between her career and a patient's life, was standing by her principles worth losing everything she'd worked for? Jamie Mitchell had always been the kind of doctor who remembered patients' names long after they left her care. At 34, she'd quickly risen through the ranks at Westlake Memorial, earning respect from colleagues and fierce loyalty from patients. Her reputation for compassionate care meant her schedule was always full, with patients specifically requesting the blonde doctor with the kind smile. But medicine wasn't the only demanding role in Jamie's life. As a single mother to 6-year-old Ethan, she juggled night shifts and emergency calls with school pickups and bedtime stories. Her apartment walls were decorated with both framed medical certificates and Ethan's colorful drawings of mommy saving people. The journey to this life hadn't been easy. Jamie had watched her parents drain their savings during her father's illness when she was a teenager. The image of her mother crying over medical bills at the kitchen table had seared itself into her memory, becoming the driving force behind her decision to attend medical school. Healthcare shouldn't be a luxury, she often said during hospital meetings, earning subtle eye rolls from administrators more concerned with bottom lines than bedside manner. In the doctor's lounge, Jamie kept a photo of her medical school graduation where she proudly recited the Hippocratic Oath. That photo had become increasingly important over the past year, a reminder of what medicine was supposed to be about as the hospital's policies shifted further away from patient care and closer to corporate profit. The bean counters are at it again, her colleague Dr. Reyes had muttered just that morning, pointing to another memo about streamlining patient throughput, the latest euphemism for moving uninsured patients elsewhere. Jamie had simply sighed, slipping her stethoscope around her neck before heading to her rounds, her blonde ponytail swinging with determined strides down the hallway. Tonight's shift had been relatively quiet, until the ambulance sirens wailed in the distance, signaling the arrival that would change everything. The trouble at Westlake Memorial had begun 18 months earlier when Horizon Healthcare Partners acquired the once community-focused hospital. Their first move was installing Robert Caldwell as CEO, a 63-year-old former insurance executive with no medical background but an impressive track record of turning underperforming healthcare assets into profitable ventures. Caldwell had wasted no time implementing his vision. Gone were the warm, mission-focused staff meetings of the past. Instead, physicians now gathered monthly in the sterile conference room where their names appeared on digital leaderboards ranked by patient revenue generation, average billing per encounter, and resource utilization efficiency. "We're not running a charity," Caldwell had announced during his first address to the medical staff. "Compassion is wonderful, but compassion doesn't keep the lights on." The shift was subtle at first: new forms for financial preclearance, updated patient transfer protocols, the quiet disappearance of certain pro bono programs. But 6 months in, the changes became impossible to ignore. Jamie had watched with growing unease as veteran nurses were replaced with less experienced staff willing to work for lower wages. Patient satisfaction surveys were buried when they reflected poorly on new policies. The most disturbing change came in the form of color-coded patient files, officially for care prioritization, but everyone knew green files received attention before yellow or red. "It's triage," defended Dr. Waters, the newly appointed department head who had quickly aligned himself with Caldwell's vision. "We're just being more efficient with limited resources." But Jamie had seen the reality behind these euphemisms. Just last month, Mrs. Patel had waited 6 hours with chest pain because her Medicare coverage placed her in the yellow category, while a 20-something tech executive with premium insurance was seen immediately for a minor sprain. The breaking point for Jamie came during last week's staff meeting when Caldwell unveiled the new Care Diversion Initiative, complete with bonuses for doctors who successfully redirected uninsured patients to county facilities. "We've identified a significant drain on our resources," Caldwell had explained, his silver hair perfectly styled as he clicked through PowerPoint slides showing graphs of profit margins. "By optimizing our patient population, we can ensure Westlake's continued financial health." The conference room had remained silent, but Jamie noticed the expressions around her, some resigned, some uncomfortable, a few nodding in agreement. That night, she'd pulled out her employment contract, scanning for clauses about patient care standards and ethical obligations. The language was vague enough to protect the hospital while offering her little recourse against the new policies. As she tied her blonde hair back the next morning, Jamie had made a quiet promise to herself. She might have to work within this new system, but she wouldn't let it change who she was as a doctor. Little did she know how soon that resolve would be tested. The warning signs had been accumulating for weeks. First came the performance review, where her supervisor noted Jamie's excessive time allocation with Medicare and uninsured patients. Then the email from administration questioning her aggressive treatment plans for several cases where less expensive options existed. "Just documenting our conversation," Dr. Waters had said after pulling her aside in the hallway. "You're a talented physician, Jamie, but your practice patterns are out of alignment with our current objectives. Consider this friendly advice." The message was clear: prioritize profit over patients or face consequences. That same week, Jamie watched Dr. Keller receive public praise for transferring 3 uninsured patients to the county hospital, exemplary resource management, according to the department-wide email. Meanwhile, the bulletin board in the staff room displayed cost-saving strategies that included limiting diagnostic tests for patients without adequate coverage. During a department meeting, Jamie had finally spoken up. "Are we really comfortable calling ourselves healthcare providers if we're turning people away based on their financial status?" she'd asked, her voice steady despite her racing heart. The room had fallen silent before Dr. Waters cleared his throat. "Dr. Mitchell, we all took the same oath, but we also have a responsibility to ensure this institution remains viable. Balance is necessary." Later that day, Jamie found a collection of patient files on her desk with a note: "For review, appropriate care level determination required." Each case involved a patient with minimal or no insurance coverage, and each seemed to be a test of her willingness to comply with the new priorities. The final warning came in the form of a memo announcing quarterly performance bonuses. The criteria made no mention of patient outcomes or care quality, only metrics related to billing optimization and appropriate resource utilization. That evening, as Jamie tucked her son into bed, he'd asked why she looked sad. "Sometimes at work, people want me to do things differently than I think they should be done," she'd explained simply. "You always tell me to do what's right even when it's hard," Ethan had reminded her, his innocent wisdom cutting to the heart of her dilemma. "Yes," she'd whispered, kissing his forehead. "I do." The emergency room doors burst open at 11:42 p.m. Paramedics wheeled in a man clutching his chest, pain etched across his face. Samuel Rivera, 38-year-old male, severe chest pain radiating to the left arm, began approximately 40 minutes ago, the paramedic reported, transferring monitors. BP 165/95, heart rate 110 and irregular. Gave aspirin on scene. Jamie moved quickly to Samuel's side, already assessing his condition as nurses connected monitoring equipment. "Mr. Rivera, I'm Dr. Mitchell. We're going to take good care of you," she assured him, her practiced calm belying the seriousness of his presentation. His ECG showed clear ST elevations, a heart attack in progress. A young woman rushed in behind the stretcher, her eyes wide with fear. "Dad. I'm here, I'm right here," she called out, reaching for his hand. "Are you family?" Jamie asked, guiding her to a spot where she wouldn't interfere with the medical team's movements. "His daughter Maria? Please help him." He was fine, then suddenly, her voice broke. "We're doing everything we can," Jamie assured her before turning back to order necessary medications and tests. Hospital Administrator Diane Howell appeared at the nursing station, tablet in hand. "We need insurance information," she stated flatly, eyeing the commotion around Samuel. Maria overheard and approached anxiously. "He lost his job at the construction company 3 months ago when they downsized. His insurance. It ended last month. We've been trying to get new coverage, but..." Howell's expression shifted subtly. She made a note on her tablet. "I see. Well, we're required to stabilize emergency conditions. Dr. Mitchell, once he's stable, please consult regarding transfer protocols to County General." Jamie nodded curtly, already focusing on Samuel's worsening condition. His blood pressure was dropping despite interventions, and the cardiac monitor showed increasingly concerning rhythms. The cardiac lab results confirmed what Jamie already suspected: Samuel needed immediate intervention. His coronary arteries were critically blocked, and without prompt treatment, heart damage would be extensive, possibly fatal. "He needs a cardiac catheterization right now," Jamie announced to her team. Howell stepped forward. "Dr. Mitchell, a word?" She led Jamie a few steps away. "County General has a cardiac unit. We should initiate transfer." "He won't survive the transfer," Jamie interrupted, keeping her voice low but firm. "The damage happening right now is irreversible. Every minute counts." Hospital policy is clear about non-emergency procedures for uninsured. This is an emergency, Jamie stated, meeting the administrator's gaze directly. I'm taking him to cath lab now. You can file whatever paperwork you need to afterward. Without waiting for a response, Jamie returned to Samuel, whose skin had taken on a gray pallor. Maria stood nearby, tears streaming down her face. Your father needs a procedure to open blocked arteries in his heart, Jamie explained quickly. I'm taking him to a specialized room right now. But the insurance, Maria began. Jamie shook her head. Don't worry about that now. This is what he needs and this is what we're going to do. As they wheeled Samuel toward the elevator, Jamie caught the hard stare from Howell, who was already typing rapidly on her tablet. In that moment, Jamie knew she'd crossed the line, but watching Samuel's monitors, she also knew she couldn't have made any other choice. The catheterization lab lights cast a blue-green glow across the room as Jamie worked swiftly to save Samuel's heart. Through the arterial access point, she threaded the catheter with practiced precision, watching the monitors that displayed the obstructed coronary arteries. 90% occlusion in the LAD, she noted to the team. Let's place a stent. Her mind flashed briefly to her brother Michael, who had suffered a similar heart attack 2 years ago. He had been fortunate, good insurance, immediate care. Not everyone had that privilege. Jamie glanced up at the observation window, noting Howell standing with arms crossed, watching the unauthorized procedure. The administrator's presence was unusual during medical interventions. This was clearly about documenting the protocol breach. But in this room, with a man's life literally in her hands, hospital politics seemed distant and insignificant. The only reality that mattered was the blocked artery she was currently navigating with careful movements. Deploying stent now, Jamie announced, her focus absolute. The procedure continued with the methodical rhythm of a well-practiced team. The minutes ticked by as she placed a second stent in another partially blocked vessel. Finally, blood flow was restored, the damaged heart muscle receiving the oxygen it desperately needed. Good flow re-established, Jamie confirmed, watching the contrast medium illuminate the now open arteries. Let's complete the procedure and get him to recovery. As the team prepared to transfer Samuel, Jamie stepped out momentarily to speak with Maria, who had been anxiously waiting outside. Your father had significant blockages in his heart arteries, Jamie explained, removing her surgical cap, her blonde ponytail falling free. We've placed 2 stents to open those blockages. He responded well to the procedure. So he's going to be okay? Maria asked, hope replacing fear in her expression. The next 24 hours are critical, but yes, I believe he'll recover, Jamie smiled reassuringly. The quick intervention prevented extensive damage to his heart muscle. Maria's relief transformed into concern. The cost. I don't know how we'll ever. Jamie placed a hand gently on her shoulder. Let's focus on your father's recovery right now. The financial aspects can be addressed later. As Maria embraced her with tearful gratitude, Jamie caught sight of Howell watching from down the hallway, already on her phone, likely reporting to administration. In that moment, looking at the profound relief on Maria's face, Jamie made her choice again. Whatever consequences came from this decision, she would face them knowing she had honored her oath and her conscience. The hospital might have changed, but she would not. This was the exact scene captured in the thumbnail, Dr. Mitchell in her blue scrubs with her blonde ponytail, leaning over with a reassuring smile for her patient, bathed in the teal-blue hospital lighting, choosing compassion over compliance. 2 hours after the procedure, Jamie entered Samuel's recovery room. The cardiac monitors showed stable rhythms, his color significantly improved. He was awake now, tired but alert. Dr. Mitchell. He recognized her immediately, his voice weak but grateful. Jamie checked his vitals and examined the access site on his wrist. How's the pain, Mr. Rivera? Scale of 1 to 10. Down to a 3, he replied. Thank you. Maria told me what you did. Jamie sat on the edge of his bed, mirroring exactly the pose from the thumbnail image, the compassionate doctor in blue scrubs connecting with her patient. Her blonde ponytail fell over her shoulder as she leaned forward slightly. You had a serious heart attack. We placed 2 stents to open blocked arteries. You'll need medication and some lifestyle changes, but with proper care, you should recover well. Samuel nodded solemnly. Maria also mentioned about the insurance situation. That's not your concern right now, Jamie assured him. I'm not usually in this position, he explained, embarrassment evident in his voice. I've worked construction since I was 19. Never missed a payment on anything. Then the company downsized and at 38, Suddenly I'm overqualified for entry roles and underqualified for management. I understand, Jamie said. Life can change quickly. Maria showed me a picture of your son, Samuel mentioned. She said you're raising him alone too. Jamie smiled. Ethan. He's 6. The most important person in my world. Maria's 17. College next year, hopefully. Samuel's voice broke slightly. I can't leave her alone. When I felt that pain in my chest, all I could think was, not now, not yet. Jamie placed her hand reassuringly on his shoulder. You're going to be around for her graduation and long after that. Their eyes met in understanding, two single parents fighting to stay strong for their children. I'll find a way to pay for this, Samuel promised. Jamie shook her head slightly. Your life is worth more than a billing code, Mr. Rivera. At 3 a.m. the emergency department had finally quieted. Jamie sat at the documentation station, staring at Samuel Rivera's electronic chart. The cardiac intervention had been successful medically, but now came the administrative aftermath. Hospital policy was explicit. Non-emergency procedures for uninsured patients required financial department clearance. Without it, the system would flag the case for review and likely deny the $43,000 procedure. Jamie glanced around the quiet nurses' station. Night shift nurse Sofia Rodriguez was organizing medications nearby. Tough case tonight, Sofia commented softly. He would have died waiting for a transfer, Jamie replied, her fingers hovering over the keyboard. Sofia nodded. You did the right thing. We all saw it. Jamie took a deep breath and began typing. In the procedure justification field, she entered, emergency intervention for STEMI with cardiogenic shock indicators. Patient deterioration prevented transfer. Immediate catheterization necessary to prevent imminent death. She was stretching the truth. Samuel hadn't been in full cardiogenic shock, though he might have developed it without intervention. She selected emergency stabilization from the procedure classification drop-down, which would bypass the insurance pre-authorization requirements. As Jamie completed the documentation, she felt Sofia watching her. It was an emergency, Jamie stated, more to herself than to the nurse. Of course it was, Sofia agreed, her eyes communicating understanding of what Jamie was really doing. Anyone could see that. Jamie submitted the report and signed out of the system. Her phone buzzed with a text message from Dr. Waters. Admin review meeting tomorrow 9 a.m. Rivera case flagged. Call me ASAP. Her stomach tightened. Someone had already reported the procedure, likely Howell from the cath lab observation window. Jamie had known there would be consequences, but the speed of the response suggested this might become more serious than a reprimand. She stepped into the empty break room to return Waters' call. Jamie, what were you thinking? He asked without preamble. Howell already sent a full report to Caldwell. They're pulling the security footage from the cath lab. He was having a major heart attack, Paul, Jamie defended. Medically, there was no other option. You could have documented it differently, Waters suggested, his voice lowered. Called it a diagnostic angiogram that revealed an emergency requiring immediate intervention. That would have been falsifying. Instead, you've handed them clear evidence of policy violation, Waters interrupted. The quarterly financial review is next week. Caldwell's looking for examples of resource misallocation to justify his next round of cuts. So I should have let a father die to make the balance sheets look better? Jamie challenged. Waters sighed heavily. Look, just prepare your case for tomorrow. Document everything medically necessary. And Jamie? They're making an example of someone. Don't let it be you. The call ended, leaving Jamie staring at the hospital's mission statement framed on the break room wall. Committed to exceptional care for every patient. The words rang hollow now, a relic from a different era. The next morning, Jamie entered the administrative conference room to find a startling scene. Rather than the informal review she'd expected, she faced what appeared to be a formal disciplinary panel. CEO Caldwell sat center, flanked by legal counsel, Dr. Waters, and 2 board members. A security officer stood by the door. Dr. Mitchell, please take a seat, Caldwell gestured to a solitary chair across from the panel. Behind him, a large screen displayed freeze frames from the catheterization lab, images capturing Jamie working on Samuel Rivera. We're reviewing the unauthorized procedure performed on patient Rivera, Caldwell began without preamble. Hospital records indicate you proceeded with an interventional catheterization valued at approximately $43,000 for an uninsured patient without required financial clearance. Mr. Rivera was experiencing an acute myocardial infarction, Jamie replied steadily. The procedure was medically necessary and time-sensitive. The hospital attorney slid a document across the table. Our policies clearly define emergency stabilization versus elective intervention. The patient could have been stabilized and transferred to County General. Transfer would have significantly delayed treatment, resulting in permanent heart damage or death, Jamie countered. That's your opinion, Caldwell responded dismissively. County has a cardiac unit perfectly capable of handling such cases. Jamie looked to Dr. Waters, expecting support from a fellow physician. Instead, he avoided her gaze. Dr. Waters, Caldwell prompted, as department head, what's your assessment of this situation? Waters cleared his throat uncomfortably. While Dr. Mitchell is certainly a skilled physician, her judgment in this case reflects a pattern of disregard for established protocols. The catheterization could have waited for proper authorization or transfer. Jamie stared at him in disbelief. Just weeks earlier, Waters had performed the exact same procedure on the hospital board chairman's wife without question. You know that's not true, Jamie challenged him directly. Medically speaking, delay would have. Furthermore, Waters continued as if she hadn't spoken, there have been previous instances where Dr. Mitchell has extended treatments beyond approved guidelines for patients with coverage limitations. The betrayal struck Jamie like a physical blow. Waters wasn't just failing to support her, he was actively building a case against her. We've reviewed your documentation, the attorney continued. You classified this as emergency stabilization, yet the timing and extensive nature of the intervention contradict that classification. The security footage confirms you spent 18 minutes counseling the patient's family afterward, Caldwell added, as if this compassion was further evidence against her. Not typical behavior for an emergency situation. On the screen, the security footage showed Jamie speaking with Maria, the concerned daughter's relief visible as Jamie shared news of the successful procedure. Each of these actions demonstrates willful violation of hospital policy, Caldwell concluded. This isn't about one procedure, Dr. Mitchell. This is about a fundamental misalignment between your priorities and this institution's operational requirements. In that moment, Jamie realized this meeting wasn't a review, it was a formality before a predetermined outcome. After the panel review, Jamie was directed to CEO Caldwell's office. The large corner space with its expansive windows overlooked the city, decorative golf trophies and industry awards arranged prominently on shelving. Caldwell gestured to a chair as he settled behind his imposing desk. A folder with Jamie's name lay open before him. Dr. Mitchell, I'll be direct. Your actions represent a serious breach of protocol that has cost this hospital significantly. Beyond the financial impact, you've undermined our entire system of authorization and resource allocation. Jamie leaned forward. With respect, Mr. Caldwell, I made a medical decision to save a man's life. That's what doctors are supposed to do. This hospital employs dozens of physicians who manage to provide care while respecting our financial constraints, he countered. Your idealism is admirable but incompatible with healthcare realities. When did we start turning away people who could be your neighbor, your friend, someone's father? Jamie challenged. The man would have died waiting for a transfer. Caldwell's expression hardened. Your emotional appeals ignore the larger picture. Westlake serves thousands of patients annually. Our sustainability depends on sound financial management. Jamie's gaze fell on a document partially visible on his desk, a proposal for executive suite renovations with a $45,000 budget highlighted, almost exactly the cost of Samuel's procedure. You realize we can't afford to set this precedent, Caldwell continued. If every doctor decided individually which policies to follow, we'd be bankrupt within a year. If every patient were treated based on their humanity rather than their coverage, maybe we'd remember why we built hospitals in the first place, Jamie responded. Caldwell closed the folder decisively. Dr. Mitchell, your employment at Westlake Memorial is terminated, effective immediately. Security will escort you to collect your personal belongings. Though she had anticipated this outcome, the finality still stunned her. 8 years of service ended in minutes. You're firing me for saving a life, she stated, not as a question but as a clarification she wanted verbalized. I'm terminating your employment for multiple policy violations and insubordination, Caldwell corrected clinically. Your behavior constitutes gross misconduct under Section 5.3 of your employment contract. As if on cue, the security officer appeared at the door. Jamie stood, removing her hospital ID badge. I became a doctor to help people. I'll find somewhere that still values that purpose. She placed her badge on his desk and walked out with dignity intact, passing the hospital's mission statement in the hallway one final time. In her car in the hospital parking lot, the full weight of what had just happened finally hit Jamie. 8 years of her career gone. Her professional reputation potentially damaged by a termination for gross misconduct. The steady income that supported her and Ethan vanished. She stared at the termination papers, noting how clinical language transformed her act of compassion into a series of violations, her medical judgment reduced to unauthorized resource allocation. Her phone rang the childcare center. Dr. Mitchell? Sorry to bother you at work, but Ethan's running a slight fever. Should I give him the children's Tylenol you provided? The ordinary parental concern collided with her new reality. She wasn't Dr. Mitchell at work anymore. She was unemployed with a mortgage, childcare expenses, and student loans still hanging over her. Yes, that's fine, she managed. I'll be picking him up early today. After ending the call, fear crept in. At 34 with a termination for cause, would another hospital hire her? Would she need to relocate, uproot Ethan from his school and friends? The medical community was smaller than most people realized. Word would spread. Her phone chimed with a text message. Unknown number. Dr. Mitchell, this is Maria Rivera. The nurse told me what happened. I don't know how to thank you for saving my dad. He's awake and asking for you. Attached was a photo of Samuel, color returned to his face, giving a weak thumbs up from his hospital bed. Jamie felt tears welling up. The image provided a moment of clarity. Whatever happened next, she had made the right choice. A man would live to see his daughter graduate, to rebuild his life. That reality existed because she had honored her oath. Wiping her eyes, she started the car. She would pick up Ethan, hold him close, and figure out their next steps together. Tomorrow would bring new challenges, but today she had been the doctor she had always aspired to be. 3 days after Jamie's termination, Maria Rivera posted on social media, Westlake Hospital fired the doctor who saved my dad's life because he doesn't have insurance. This is healthcare in America. Dear Jimmy Mitchell, medicine over money. The post included a photo of Samuel recovering in his hospital bed alongside Jamie's name and brief details of the situation. Within hours, it had been shared thousands of times. By the following morning, local news station KNWR had picked up the story, local doctor terminated after providing life-saving care to uninsured patient. The reporter had framed it as a human interest piece. Is this a case of a rule-breaking doctor or a broken healthcare system? Jamie hadn't sought publicity. In fact, she'd been focused on sending out job applications and revising her resume to address the termination as diplomatically as possible. But when her phone began ringing with interview requests, she realized the story had taken on a life of its own. What truly changed the narrative was when former patients began coming forward with their own stories. An elderly woman described how Dr. Mitchell had spent hours coordinating affordable medication options when her insurance wouldn't cover her prescriptions. A young family shared how Jamie had personally called specialists until finding one who would see their child within their limited coverage. Most damaging to Westlake was Samuel Rivera's television interview. Still recovering but determined, he appeared on camera in his work shirt with his 30-year company service pin visible. I worked hard my whole life, he explained, his voice emotional. Paid taxes, paid insurance premiums for years. Then suddenly I'm laid off, and my life is considered too expensive to save? Dr. Mitchell was the only one who saw me as a person, not a financial liability. As public outrage grew, Westlake issued a terse statement. Personnel decisions are confidential. Westlake Memorial remains committed to providing appropriate care within established guidelines. The corporate response only fueled the controversy. Healthcare advocacy groups began citing Jamie's case in discussions about profit-driven medicine. A hashtag appeared. #WeStandWith Dr. Mitchell. Jamie watched the growing movement with mixed emotions. While gratified by the support, she was still jobless, still worried about supporting her son. Each passing day without income increased her anxiety. Then came another unexpected development. A patient advocacy lawyer contacted her. Dr. Mitchell, there may be more to your termination than you realize. Some of your former colleagues want to talk. The knock on Jamie's apartment door came at 9 p.m., after she'd put Ethan to bed. Opening it revealed Sofia Rodriguez, the night shift nurse from the cardiac unit. Sorry to come unannounced, Sofia said softly, glancing down the hallway nervously. I couldn't risk contacting you through official channels. Inside, Sofia placed a USB drive on the kitchen table. I've been documenting cases for the past year, patients transferred or denied care based purely on insurance status. Your situation with Mr. Rivera isn't unique, it's just that you refuse to play along. The drive contained spreadsheets meticulously recording dates, patient identifiers, conditions, and outcomes. Many entries included notes like, transfer to county, insurance insufficient, for conditions requiring immediate intervention. There's a code in the electronic record system, Sophia explained. PR4, Payment Review Level 4, it flags patients who should be guided elsewhere. Your violation was treating a PR4 patient fully. Why are you showing me this? Jamie asked, stunned by the scope of the documentation. Because I've been waiting for someone with credibility to help expose this, Sophia replied. The nurses see everything but nobody listens to us. A doctor, though, especially one who sacrificed her job for a patient, people will listen to you. For the first time since her termination, Jamie felt something beyond personal loss, a sense of purpose emerging from the crisis. There's more, Sophia added. You should know who else is gathering evidence against Westlake. You're not fighting alone. Within days, a more explosive development broke. Linda Hashimoto, a financial administrator from Westlake's billing department, leaked internal documents to the state medical board and select media outlets. The documents revealed a systematic hospital policy specifically targeting patients in the coverage gap, including those between jobs, waiting for Medicare eligibility, or with limited insurance. Local news aired footage of CEO Caldwell hurrying to his car, refusing to answer questions about the leaked documents or his $3.8 million annual compensation package. The contrast between his salary and the denied treatments created a damning visual narrative. Hospital board members began distancing themselves from the controversy. These operational decisions were made at the executive level, one anonymous board member told reporters. The full implications were never presented to the board. Most shocking was the revelation of an internal memo describing a cost-benefit analysis of treating versus transferring underinsured patients, with explicit instructions to prioritize resource allocation toward patients with comprehensive coverage or ability to pay. The state health department announced an investigation into Westlake's practices. Other hospitals in the Horizon Healthcare Partners network faced scrutiny as similar patterns emerged across their facilities. For Jamie, the revelations brought vindication but no immediate relief from her unemployment. She had become the face of a larger problem in healthcare, frequently cited in news reports and advocacy campaigns, but still faced her own financial challenges and career uncertainty. Then came an unexpected call that would change everything. Dr. Mitchell? This is Dr. Eleanor Chin, Chief of Medicine at Memorial Regional. Jamie recognized the name immediately. Eleanor Chin was a respected cardiologist who had built Memorial Regional's cardiac program into one of the best in the state. I've been following your situation, Dr. Chin continued. I wonder if you might have time to meet with me tomorrow? The following afternoon, Jamie sat across from Dr. Chin in her office. Unlike Caldwell's sterile, trophy-filled space, Chin's walls displayed medical research papers, family photos, and thank you cards from patients. 20 years ago, I was in a similar position, Chin explained, surprising Jamie. Different hospital, different patient, same essential choice, protocol versus a person's life. I chose the patient and nearly lost my career. Chin revealed she'd spent years quietly building a program at Memorial Regional specifically designed to address healthcare gaps. Called the Community Care Initiative, it provided treatment pathways for patients without adequate insurance. We've secured grant funding, private donations, and negotiated special arrangements with medical suppliers, Chin explained. It's not perfect, but it allows our physicians to practice medicine without constantly weighing a patient's financial status against their health needs. Then came the offer. I need a physician to help expand this program, someone who has demonstrated they understand why it matters. I'd like that person to be you, Dr. Mitchell. The position would include clinical duties, program development, and competitive compensation. Moreover, it would provide Jamie something priceless, the chance to practice medicine according to her values. This incident at Westlake, it's happening everywhere, Chin said. We need doctors willing to stand up and say this isn't what medicine should be. Your stance cost you personally, but it's inspired many of our younger physicians to question practices they've been told to accept. For the first time since her termination, Jamie felt a genuine sense of hope. 1 month later, Jamie entered Samuel Rivera.